So at the very outset, I think Mr. Lulla and both of you have kind of overrated the most accomplished qualitist tag. I think there are people in this country who've done far better, but nonetheless, thanks for the compliment. My journey in healthcare quality probably began way back in 2003. I work for Wockhardt Hospitals. I've done so for the better part of 2 decades now. And Wockhardt with its background in pharmaceuticals, when we launched the hospitals, the chairman of the company, Dr. Korakiwala, was very keen that healthcare should become very quality driven, process driven, and that's one of the things that we learned to kind of imbibe in our DNA. Our parent company, Wockhardt Limited, was somebody who was very gung ho on quality of the products that it delivered. We started preparing for our Joint Commission International Accreditation, which is still supposed to be the gold standard of healthcare quality, and we started preparing for this way back in 2003. Now, as laboratorians, we are all used to doing quality assurance, quality control. We all do Levy-Jennings charts, and we look up all these deviations, and we understand SD and all of that. But it was very, very exciting when we learned that we could apply the same to care pathways of bypass surgeries. We could look at this. We could look at outcomes of total knee replacement. So we could look at outcomes of angioplasties. And I'm talking in language which even the non-medicals in this audience should understand. So when we realized that and we understood that we should be able to comfortably apply the Donner-Median model of structure, process, outcome, and review within healthcare, we all got excited and we started preparing for our Joint Commission International. I think we at Wockhardt were privileged and we learned from Dr. Lloyd Nazareth, who is currently located in Bangalore and doing a lot of philanthropic work for Bangalore to combat the pandemic. Dr. Lloyd Nazareth was a driver of quality. He was very passionate, having trained with Mr. Lulla. So I think the genetic flow is very clear, from the gurus of healthcare to where we are. The grandfatherly equation, so to speak, through Dr. Lloyd is something that we all imbibed. We understood that the backbone of anything related to quality is going to be process. We started working on our process. We also learned that you just can't have something called quality improvement. You've got to focus on the process. And essentially what we're all doing is process improvement. We're also looking at product improvement. And as we went through the Joint Commission International Accreditation standards, we kind of broke up the pizza into very, very minute pieces. Everybody got involved. We also then subsequently got training from Harvard for quality in healthcare way back in 2003. And just to kind of put a sort of a timeline in place, we launched national accreditation in our country in 2005, which is exactly when we already finished our accreditation cycle. So I think that was the primary introduction to quality. And then we kind of got hungry. Our appetite got whetted out, and we did a quality improvement project, which was the first with nursing, infection control. As you know, I was a microbiologist. And we did our first quality improvement project on reduction of ventilator-associated pneumonias, which is a healthcare-associated infection, which is something that we give to our patients as an unwanted gift. And we realized that just by putting things in place, putting processes in place, we were actually able to improve outcomes. And this is something which I teach now. I'm passionate about it because we were actually able to improve clinical outcomes. It's not just the turnaround times and the patient satisfaction. We were able to actually improve a patient's life, and which goes very well with today's tagline of Wockhardt, which is life wins. We learned the importance of teamwork, and that's something which led us on to do more and more quality improvement projects. At some stage, we started talking with qualitists across the board. We got the Healthcare Management Award in Asia for this quality improvement project. We are happy to say that you need to have a mentor like Dr. Lloyd, who was himself mentored by Mr. Lulla. I think quality is a good journey. The high is there, the thrill is there. And most importantly, as doctors, we learn to give back to society. We're a poor country, and if corporate healthcare and trust hospitals really improve on their quality, we can serve so many more people.